explanation, I'm willing to give it. I've always got time for you guys because you guys always take care of me. So, let me start off by saying in the Medicrea spine set for a deformity setup, it's normally these 5 trays. You have an implant tray, that is the main implant tray. It's implant 1. And for those of you who are very familiar, like Lynette, Robert, Kim, people who've seen these trays for a long time, and Sandra especially. Sandra's probably seen these trays longer than anybody. If you have anything you want to add, please do, okay? But the implant number 1 tray is basically rod tray on top, and then the implants are actually in these caddies, okay? All these caddies slide in a specific way. Turn it around. When you're putting these caddies in, they have little slots for each caddy to go in. And if you look, they'll all go the same way, and the arrow should point to the arrow, okay? Otherwise, you're going to be trying to force it in there, and then it's not going to fit right. So you always want to make sure you see the labeling on the outside, and the arrow matches the arrow, okay? Yeah. That ensures that you know that it's in there the right way. Other than that, a lot of times I've seen people pull these out and just lay them out, send them through the wash, kind of just in their caddies like this or like this. When I send them through, I usually take the rod tray off the top with the lid and I send it through like this because it's wide open underneath, okay? So it gets good drainage. Any questions on that? Okay. From here on out, these are all considered instrument trays. Instrument 1, 2, 3, and 4. Now, the only one that's not essentially a dump tray is 1. And that's only because the drivers and taps and handles, basically, I keep this just to keep it a little bit better organized. The rest of the stuff is kind of bulky items, so we did this a couple years back to kind of reduce the amount of trays that we were doing. And you'll probably see other systems come through where they just use dump trays, and that's to reduce the amount of trays. Otherwise, to actually have a place for each one of these to have a spot in the tray, you almost double the amount of trays that you have to use. So that's why this is the way it is. So tray 1 is pretty self-explanatory. Ratchet handles, taps, drivers. The ratchet handles, I'd say, of course you want to check the actual part that, like the knurl knob that actually pulls back, and you put the driver in that locks it in place. That can get tissue inside that sleeve right there, so you just want to pull it back and make sure that gets cleaned. That's on all the handles. The screwdrivers in the past, and Lynette, you know this, in the past they were taking it apart. You can take it apart. I don't suggest it because this part of the instrument doesn't necessarily get a lot of blood and tissue on it. So you want to check this. Now, if you want to, this T20 driver in here will actually take the nut out. Probably want to put a T-handle in it. And I don't know if you can see this, but the nut itself actually will stay in. So you don't have to take the nut all the way out. And that will allow you to disassemble it completely. In the past, what's happened is when somebody's put it back together, you slide that back in. If that nut doesn't follow in that cylinder perfectly, it'll get caught on the outside of the edge, of the body, and somebody will keep tightening, and that nut will break very easily. Okay, so if you do take it apart, make sure you're very careful not to over tighten it because you will break the nut in it. So I'd say if you need to take it apart, you can. It's with this small star driver that's in the same tray. Okay? Lynette, you got anything to add to that? Yep. Definitely want to check. That's the end that's actually going to get dirty because that's where the screw goes. they're putting the screw in the patient. Sometimes after they put the screw in, they'll reintroduce this to kind of move the screw, and then they can get tissue inside that. Okay? It is not. How do I get out what?
Like you said, be careful when cleaning it and stuff. Like how do you?
Oh, when you take this off, it is cannulated all the way
so
through.
You want us to take it apart. So that's what I'm saying. If we don't take it apart.
Yeah. I mean, just be careful with the nut if you do take it apart. Okay. Outside of that, this is cannulated, so we don't ever use this, but I would just, this comes down like that. It doesn't come apart that I know of, or that I've been taught. So you'll just need to like let it fold down like that. It's kind of like one of those old-timey screwdrivers that as you push down, it turns. So if any place will get dirty, it'll probably be through here. So you can just check that as well. Taps and drivers, none of them are cannulated, so you don't have to worry about that. These drivers are cannulated, and we use these quite a bit. We call it a speed driver. It's like, on here they call it a, basically it's a nut driver shaft. But it is cannulated, and this gets a lot of use. So you want to check this instrument specifically, because we use this throughout the whole surgery, tightening and loosening, and this will come in contact with tissue and it will get up inside. And this is one of the things that they check when we're opening. So make sure you run something through this instrument as well. Any questions on tray 1? Okay. Tray 2 is basically some loose items. This is the tray that probably gets the most attention because of these instruments and these instruments. This instrument in particular is the one that comes up dirty 9 out of 10 times. And it is because this is the final tightening instrument for the set. So when they're breaking, let me back up a little bit here. So just so you guys have some reference. This nut comes down on the stem like that, and there's usually a connector in there. And then when they go to final tighten at the end of surgery, this stem gets broken off and the top part of this nut gets broken off. And they collect in this. So as they break them off, they keep stacking up in here. And a lot of times they'll get soft tissue in that when they're breaking it off. And that normally is what causes a lot of the tissue that gets stuck up in here. And if it's been a busy day, these trays may, I mean, I now squirt inside of this. I try to do it every time. There may be a time where I don't do it upstairs, but I do spray all the trays. But I will stop in instruments like this, speed driver, these nut starters, and these of course go all the way through. They're cannulated as well. I will squirt inside them just to kind of start breaking down the tissue that could be inside them. But this one in particular, make sure you look at it really well. It should be completely shiny all the way through. If there's any blemish or anything on the inside of this handle, they will send it back. There are a couple scrub techs that will not use it if they see a speck in it. So just make sure this one is shiny all the way through, okay?
Now just running a good pipe cleaner through it, correct?
Yeah.
Okay.
There are some pipe cleaners in the back. I was going to ask if you guys have any bigger ones. I don't know if that's possible.
Yeah, we do have some various size brushes of the larger size.
Yeah.
We just need to figure out what size that cannulation is, so we can make sure it matches the brush, and we can get contact all the way around.
Okay. But that instrument, if you guys get backed up and, you know, middle of season, you guys are super busy, you're turning a lot of trays over sometimes during the day. Night crew, which you'll probably see this video, they usually get a lot of stuff at the end of the day when we've had a busy week. this stuff may sit here downstairs and decontam for a few hours, which gives it time to dry and stick. So if you're back there, just make sure you look at that, and when you're checking it on this side, lots of extra attention to this and this nut starter, because they do get a lot of tissue. What's left in here is, this is a positioning handle for the screw itself. Just check the tip of this. And then these, you're going to want to check the hinge here, the spring. They don't really come apart. So you're going to open this, if they come up closed like this, you take the button and it opens like that. Okay? So you're going to want to check underneath the cap, because as they're working with this, their hands could be bloody, have tissue on them, and as they're squeezing them together, you could get tissue up in the top of that. Definitely tissue is coming in contact here, possibly the hinge. So look at these as well. And then there's just spinal rods in here. Of course, you know, those are implants. But there's nothing, you can look at them, but if they're still laying in here, that means that they weren't used. Moving on to any questions on tray 2. So tray 2 is, this is the culprit.
That handle, make sure that screw is out, show them that how that's.
Oh, yeah, sorry. When they use this screw goes into the top of this, because sometimes this is used in conjunction, so that's why that top needs to be in the top of that T-handle. When you guys clean it, leave this nut out. Just leave it loose in the bottom of the tray. Don't put it back together, because the scrub techs, if they pull this out when they're unwrapping and they see that nut in, what that tells them is somebody didn't take it apart and clean it right. Okay? So just make sure that that nut comes off, check the threads there, and make sure that is not screwed into this when you send it through for sterilization. Tray 3 is really just rod manipulation stuff. So this is kind of stuff that you guys will normally see, like compressors and extractors. So you're going to want to check the hinges. These just, they don't come apart. So you're just going to have to kind of move them around and check the hinge. French benders, these are just big kind of monolithic instruments that really don't have any cannulation or anything. So just make sure that the little divots and stuff like that, like right here, just make sure that there's nothing caught in the divots. Rod grippers tend to kind of have a lot of moving parts on them. So again, this is something that doesn't normally come apart, but you're just going to have to kind of move it around to kind of make sure that there's nothing there. Everything else is pretty much monolithic, and what you see is probably, there's nothing going to be hidden on that. This caddy right here has extensions, and these extensions help with facilitation of the rod dropping down onto the screw. So this instrument right here, these are reusable, they're nitinol, so you can bend them, whatnot, but they have a cannulation here where they go on top of the screw. They can get tissue inside of them. So you're just going to want to eye that and make sure that you don't see anything in the bottom of these extensions. You have a few of these, okay?
They're fully canned or partially canned?
Just partial.
Okay.
They don't go all the way through. That's pretty much it for tray 3. Any questions on that? Anything else to add? Okay. The last tray, tray 4, is a hook tray. I have implants in a caddy. They are working to actually have a rod-specific tray where these all have a place. So, but if you see any loose implants laying in here, I don't care if you put them in the right place, just put them in this caddy, okay? Again, all the instruments in here, for the most part, are monolithic. You have a long version of this in this tray. This is something, again, that has a nut that screws into the top of it. So you're gonna wanna make sure that nut is off.